Hi everyone, welcome to Injection Insight with Aaron. I'm Aaron,
I'm Lisa.
and today we're going to be discussing dermal fillers, different types of dermal fillers, and
What they can be used for, some areas that may be unexpected that you don't know you need or that you can get it.
don't know you wanted.
Yeah. And then just some of our own experience as well.
Yeah,
So,
definitely.
what are the different types of dermal fillers?
I mean, if you want to get to the basics, basically you have the hyaluronic acid dermal fillers, and each one is kind of formulated slightly different depending on the brand. And then you have the calcium hydroxyl apatite, which is the radius filler. It's a biostimulant as well as a dermal filler. And then you can get into the Sculptra and that aspect of it. But so basically with the dermal fillers, for instance, the ones that we offer here in our office, which, it can fluctuate from here to there depending on, at the time what we're, working on. But right now we have like the Revenus Versa, the RHA, which is a really, it's a newer brand, but it's a good one as well. We have the Juvederm and the Radius.
Perfect. And then, so what are some, I mean, we know the common areas and we'll go into that, but what are some of the unexpected areas you can use
The
filler?
fun stuff. I love doing things that are not as common, just like the typical, like, mind you, love doing lips. That's great.
We love the
yes, but I like doing the off, the odd spots, right? Like somebody has, the women that are, tend to be a little older or have very heavy earrings, their piercings start to droop and they start sagging, and it almost looks like their earlobes are melting. And in all due respect, but there's a way to fix that. So you add some dermal filler in there to help support the bottom. It holds it up. It literally like reshapes that earlobe, gives them that volume back, and then supports it for the earring, which is great because then now those earrings that they've been wanting to wear but they don't because their earlobes look all droopy and saggy, they can now wear. Yeah.
And then you can also do in your hands, right?
Yes. Yeah. So
I hate my hands, so that's why I'm trying to hide.
So as we age, we lose volume. We lose volume in our hands. So I don't know if you can see in the camera or not, but basically our tendons and our veins start to show more and more. So basically what we do is we add the dermal filler in between, and we smooth it out, and it gives that nice layer between the skin and the tendons and the veins.
Just plumping everything.
It literally plumps it up, makes you look
yeah.
more youthful. And a lot of people, some people, not everybody, some people fixate on specific things on their body, whether it's the earlobes or the hands or the elbows or the knees, right? These are areas that are not very common, but areas that can truly bother somebody to where they don't wear a dress.
Yeah.
They don't wear shorts.
Yeah.
They don't wear long sleeves because their knees, or they wear gloves.
Yeah.
So treating those areas and giving them that confidence back with something as simple as dermal filler that takes 20 minutes is, you just can't get that.
Yeah.
It's amazing. And I love the feeling of knowing that that person is now confident to go to that party in that dress or whatnot. So,
yeah. And it can just change the face so much, right? So just a little bit in the nose area. I know you just had somebody the other day where we kind of did that.
Yes.
The chin is a big difference, makes a big difference on somebody's profile as well.
So in regards to for instance, for the nose, right? The nose is a very tricky one, and out of all the areas, I would say is the most tricky, and I have the most precautions with in regards to who I do the nose filler on, the area I do it. There's a lot of guidelines that I will not just do anybody's nose. It just will not happen for safety purposes, because my clients' health it's always number one for me and their safety. But if I was doing the nose, a lot of people have like a little, like, not a lot, but many have like a hump, and they just want to mask the hump, or they don't have a bridge to their nose and they want to fill in the bridge and give themselves some more of that, like the slope, or that kind of
good angle.
Or trending for a while was the oh my gosh, the Tinkerbell tip lift. Do you remember that one? I think it's kind of died down a little bit.
Yeah, I think so.
But it's basically where you add filler in the tip and just give them this slight little lift. If anybody has, you can always Google it if you're not sure. So in regards to the dermal fillers, right, like different locations and everything, and also the person. So basically, the dermal fillers last anywhere from 9 months to a year, but depending on the person's metabolism,
Very true. Yeah.
and when if they work out a lot or they're taking specific medications, that can alter how long it lasts. Can maybe wear off a little faster. Some people it lasts even longer. So it varies, but typically about 9 months to a year. And the location as well.
I was going to ask that. Yeah. So
Yes.
what is the shortest length of time one will last? Like which area doesn't last?
So typically I've seen, obviously it varies, but typically it's about 6 months I've seen. And that's usually in like the lip area. It's anywhere that moves a lot. You get lots of movement. So maybe the laugh lines or the marionette lines, they can wear off a bit faster. That's just because of all the movement, basically.
Okay.
But typically it still lasts a good amount of time.
When you're doing dermal fillers in the different areas, how quickly do you see a result?
That's a great question. So in regards to how long how fast you see it. So typically you'll see with dermal fillers, you'll see instant results. You'll see the instant, but then you start having swelling. So in regards to the hyaluronic acid versus the calcium-based filler, the Radiesse. So the hyaluronic acid filler, you'll say I did your lips, right? You'll have the initial swelling from the needles and all of that, and then as your body settles, it swells more, so you'll see more swelling day 2, day 3, versus if you did Radiesse, which is the calcium based filler, which for instance you would do on, I don't know, say I did the cheek line, you'll notice instant swelling, and it might look a little scary, but it starts off high and tapers down, whereas the hyaluronic acid starts off low and it increases and then tapers down. So it's slightly different. So as long as the patient is educated prior to and knows what to expect, they're not going to freak out.
And always plan ahead too. I know we have a lot of people that want to get things done, but they have an event that weekend or whatever. So you just got to expect the swelling and then also the bruising, to wear off.
And that goes back to education, right? Education, making sure that the client is fully aware of what's going on and what the risks are. Because a lot of people will come in and have an event and not want a single bruise. And unfortunately, these needles are going in your face. There's a
You're
risk.
gonna bruise,
There's a risk, and it is what it is. As long as you're aware of it, should be fine.
And everybody's bruising is different, but just know that that's always a risk.
Also with the bruising, what have you been eating? Do you take any blood thinners like aspirins? Do you take any ibuprofens, anything like that? Do you have any medications that can thin the blood?
Did you drink the night before?
Did you drink a couple martinis the night before? We're not judging, but just let us know. But yeah, these things we need to know, and so we can give you proper outcome expectations.
Yeah. So what are some of the procedures that you've had done or areas?
So for myself, we discussed in a previous episode, I do my microneedling with the PRP. I'm very big on that for texture. I also do my neurotoxin. Right now, I did mine about 2 days ago. I did my Xeomin, so it should be kicking in right now. And then I've done my jawline and my cheeks. For myself, I had a fellow injector inject Radiesse in my jawline, my cheek, and my chin. So for me, I did the calcium hydroxyapatite, which is the Radiesse, because I wanted it to stimulate collagen. I wanted it to fill as well as give me like that sharp look. So that's what I decided to do, and then also give me a little bit more projection in my chin. Love it. I love the results, and with the Radiesse, it does last 12 to 18 months for the actual fill part of it, and then it stimulates collagen. It can stimulate collagen up to about 3 years.
Oh, that's
so
amazing.
And I want those benefits. I would do hyaluronic acid as well, but as of right now, I'm really loving the Radiesse for my cheeks and jawline. So.
That's good.
Yeah. All right. So now we discussed me. Let's talk about you.
So, obviously you do all my stuff now. So you've done my lips, threads. I get the Xeomin.
which your lips look amazing, by the
He
way.
just
Not to
did
toot
them
my
the
own
other
horn or
week.
anything,
Yeah,
but
so they look really good, and they were very swollen.
Yeah.
And I know the or the protocol to that, but yeah, it is a little shocking at
And
first.
we
But
didn't
they were
use
good.
we didn't use Radiesse on your lips, right? What did we use for your lips?
Versa.
And
Yeah.
that is the hyaluronic acid. If anybody's wondering, it's a softer, more malleable filler that's going to give you that natural feel. So if you're kissing the person and they have filler, you want something soft and natural. So I'm just throwing that out there because you don't want something hard like a rock, which Radiesse
no,
would do.
definitely. And then you've done my threads, which we've talked about. And the thing I like about you, though, too, is like when we were doing my lips, I asked you, what do you think? What's next? Type of thing. Yes. So I always plan ahead because you don't want to do too much all at once either and look crazy.
You don't. I mean, sorry to cut you off.
Mm-hmm.
So for myself, as an injector, as a nurse in the medical field, my goal is not to give you my image of what you should look like. My goal is to give you that confidence in what you want. So if you've noticed your volume loss in your cheeks, okay, we're going to focus on the cheeks, give you some of that volume loss. I'll give you my recommendations, but the end of the day, it's your face and it's what you would like. Obviously, I will say, hey, you're getting crazy. Like, let's calm it down a little bit in the most respectful way, of course. But yeah, my goal is to make you feel confident. It's not to change who you are, how you look.
Perfect.
Yeah.
So me saying that I'm kind of planning out what I want to do next, is there something that you want to do next, or do you know?
Yeah, so
you got your treatment plan for yourself?
Yeah, so I mean, just like my clients and my patients, I always recommend having that plan, right? So what are your goals over the next year, right? Do you want to treat your eyes? Do you want to treat your chin? Just like having that goal and having it planned out. So for myself, we discussed, I've done my jawline, I've done my cheeks. My next would be my neck. I do notice texture and the tech neck lines, which we'll discuss right now. So basically there's the lines that go across the neck, and as we lose collagen and all of that, and we look down, those lines start to exactly. Yeah. Those lines start to form. So what I'm going to do is do hyper dilute Radiesse, which is once again the calcium based filler, and the process basically is where it's the filler is therefore diluted, and it becomes less of a filler and more of a biostimulant. So that way it can stimulate the collagen, soften the neck, and make it just more youthful. And obviously I wouldn't be doing it on myself. I would have a fellow injector do it for me for safety reasons. But yeah, that would be my next goal aesthetically, in addition to obviously my Botox and whatnot. My upkeep.
Anything that can stimulate the collagen, though, is going to be good long term. Yeah. All right, so...
And how about yourself? Is there anything? I think right now, I mean, honestly, you look amazing. What would you say your plan down the road would be?
I want to do a microneedling again. I think I'm due. And maybe the temple filler that we talked about.
Yeah, we did discuss that.
Because it is another area that you may not think of, and it does show signs of aging. The temples, really if they get hollow, and then also just the whole neck décolleté area. Yeah. You could tell somebody's age from.
And the décolleté area as well. With that, I discussed what I would do for my neck, which would be help stimulate. You could do the same thing for the décolleté, and women tend to lay sideways, and as you lose the collagen, you get those creases in between the chest décolleté area, and basically we would fan the product in that area and soften those lines and help turn back the clock in regards to that. Yeah,
there's so many things that you could do with fillers, so many different options and products.
And you mentioned the temples. With the temples, you can do hyaluronic acid dermal filler or the calcium hydroxyapatite, which is the Radiesse one. You could do either of those. They both yield amazing results, very natural. And then also with that, as we age, we lose volume in our temples, and therefore the brows start to kind of go down because the volume is not there. So with that, we fill that area, and it gives you a nice little brow lift as well. Obviously nothing crazy, but it gives you a nice little lift.
Natural. That's good. All right, and we have another code for
yes,
today.
So for this episode, the code at the end of the episode, so make sure you let us know. For this one is skincare 20.
Skincare 20, and that'll get you 20% off of any skincare products that we have here.
So until next time,
Thank you for listening. Make sure to follow, like, all of the things. Check out our Instagram.
And if you're interested in booking a consultation or an appointment, we're going to have our link down below.
Thank you.